moving on to the next thing. Now the phases of the cardiac cycle. What we know is cardiac cycle has two parts, atrial part and the ventricular part. So here I have written all the names which you are confused with. I'll just explain everything. This side one, this is about the ventricles. This is about the ventricles, and this side is about the atria. Okay, we'll be discussing each. Now when we see ventricles, the main important part is ventricles, because ventricles are the part of the heart that is supplying blood to our body. So what we need to know in detail is about the ventricles. Okay, looking at the each and every phase, first we'll be seeing isovolumetric contraction and period of ejection. See, these are two events which are taking place in ventricular systole, means when the ventricle is contracting. Okay, and these three subtypes, this is the phase of ventricular diastole, that is when the ventricle is relaxing. Okay, looking into this, we will be seeing one picture here. Okay, this one, this is about the ventricles, I'll tell you. See, when we see this picture, what we see is, first there is atrial systole. What happens during atrial systole is the blood flows from the atria to the ventricles through the valves, that is the cuspid valves, bicuspid and the tricuspid valves. Now when we see, okay, this is the atrial systole, and after this atrial systole we'll be seeing the ventricular events in this picture. Okay, so focus on the ventricular events. First we see here is isovolumetric ventricular contraction, then the ventricular systole, and then the diastole. What happens in isovolumetric ventricular contraction? See, when the blood flows to the ventricle, okay, always remember that blood will flow from a high pressure area to a low pressure area. Okay, so in this what happens is the blood flows from the atria to the ventricle. Now the ventricular events will start. The first event taking place is the isovolumetric ventricular contraction. Iso meaning same, volumetric meaning volume is same. Okay, so this is the event, this is the phase when the volume is same, volume is not changing, still the ventricular is contracting. This happens when the valve, see, you can see one valve here, one valve here. Okay, I'll take different pencil. Okay, so this here you can see one valve, here you can see one valve. The red part is the oxygenated and the blue part is the deoxygenated part. Okay, so the when we see the right side of the heart, these two valves, this one and this one, these are the two valves which are closed during isovolumetric contraction, because if any of the valve will open, there will be change in the volume of blood in the right ventricle. So what we want is there should be no change in volume. So the tricuspid, so the cuspid valves, cuspid as well as the semilunar valves, both are closed in this time. Okay, these are closed during isovolumetric ventricular contraction. When we see the next phase, that is the period of ejection, this is actually the phase of ventricular systole. In this phase what happens, the period of ejection, there is ejection of blood. See, whenever there is ventricular systole, there are two things. First is isovolumetric contraction. This is when both the valves are closed, but still the ventricle starts contracting and the pressure build up. Due to this pressure build up, the semilunar valves open, and this semilunar valves then opens, and there is period of ejection during which the blood flows from the left ventricle or the right ventricle towards the lungs or the body. Okay, so depending upon which part it is. So the period of ejection is when the semilunar valves are open and the cuspid valves are closed. Seeing the relaxation, so what happened in contraction is there was isovolumetric when both the valves were closed, and then there was period of ejection. Period of ejection, when the blood flowed from the ventricles away from the ventricles. Okay, basically it is away from the ventricles. Seeing the relaxation phase, we have again three parts. This is not so important, but you should know about it. First thing is isovolumetric relaxation. This happens when the blood flows out of the ventricles, the pressure decreases inside the ventricles. Okay, so this pressure keeps on decreasing, and finally it reaches a point when there is no more blood inside the ventricle. So the pressure is minimum. And now at this time there is isovolumetric relaxation, because there is no blood in the ventricle, so there is no change in the volume of blood inside the ventricles, but there is relaxation. So there is isovolumetric relaxation, the first thing happening. Then the second thing is rapid inflow. This rapid inflow is actually what? The blood flowing from the atria to the ventricles. When will this happen? Wait, I'll tell you. Okay, see, remember this diagram, it will be easier. Okay, this is a very simplified diagram of heart. You have four chambers: right atria, left atria, right ventricle, left ventricle, the aorta, the pulmonary artery, and these are the semilunar walls, the cuspid walls. So looking into this picture, we were seeing when just after the ventricular contraction, what happens is the pressure inside the right ventricle is very low. It's zero, almost zero. Okay, so it is very low. So the pressure inside the right ventricle is very low, and at this time there is venous return happening into the right atria. When the ventricle is relaxed, there is blood coming into the right atria. Now after the isovolumetric relaxation of the right ventricle, there is rapid inflow of from the right atria to the right ventricle. Why is it? Because there is very low pressure inside the right ventricle, but there is high pressure build up inside the right atria because of this venous return. So because of this, what happens? There is sudden opening of this valve, the cuspid valve. Okay, this cuspid valve, and this cuspid valve opens up and the blood flows from the right atria to the right ventricle, or you can say left atria to the left ventricle. See, always right and left, the valves open and close at the same time. Okay, the right one and the left one. We talk about what event is important at that time. So now we are talking about the right atria. So this is rapid filling phase, when the valves just open up because of the high pressure inside the right atria and the blood flows into the right ventricle. This was when the rapid filling phase was there. Next phase is the diastasis phase. In the diastasis phase, what happens is, diastasis, the meaning of diastasis you should know. Diastasis is the phase when all the four chambers of the heart is in relaxed state. Okay, diastasis means relaxed. So all the four chamber is in relaxed state. What happens just after the rapid filling phase? Just after the rapid filling phase, the atria is having no more blood, right? Because all the blood has gone to right ventricle. But still at that time there is venous return happening. And this venous return is happening, but there is no pressure build up inside the right atria. Why? Because this valve has opened up already, and whatever blood the right atria is receiving, it is already giving up to the right ventricle. So there is pressure will be building up, slowly it will be building up inside the right ventricle and not the atria, because the blood directly from venous return comes to the right atria, and through this valve, because it is open, it goes to the right ventricle. At this time, the atria, the ventricle, everyone is in relaxation state. So that state is known as diastasis state. Diastasis is the phase when all the four chambers of the heart is in relaxed state. And now what we see is, when this diastasis phase just gets over, the blood would have flown into the right ventricle and there will be pressure build up inside the right ventricle. And now again the isovolumetric contraction will start, because now the ventricle has relaxed enough. Now it will start contracting, and first thing that happens is isovolumetric contraction. This is the contraction when both the valves closes after this rapid filling and the diastasis. This valve closes, and there is the closure of this valve too. So there is isovolumetric contraction, and the phases will see what phases we saw is they will return: isovolumetric contraction, then period of ejection, then this, then this, then this. So it just goes on, it never stops. Moving on to the atrial phase. These are the atrial phase. Atrial phase we have is atrial systole and diastole. Atrial events are not so prominent because it merges out with the ventricle. We need ventricles because we need blood to our body. Now atrial we will see. Atrial only two phases are there, atrial systole and diastole. We don't divide it into any events. Looking into the atrial systole and diastole, what happens is, in this we saw actually atrial systole. When we see atrial systole, this is the atrial contraction, and when will this happen is just after the rapid filling phase. Rapid filling will actually allow most of the blood to enter the right ventricle, but still in some walls and somewhere like in the walls and all, there will be some blood remaining. This atrial systole, what it does is it pumps blood, like this contracts, and the remaining blood, it flows to the right ventricle. So that was atrial systole. And just after this, when this valve closes, when this cuspid valve closes, this atria again goes into a phase of diastole. So if you remember what we saw in cardiac cycle, the timing was the systole takes place for 0.1 second, whereas systole takes place for 0.1 second, whereas diastole it takes place for 0.7 seconds. So most of the time the atria is in diastole phase. Only for 0.1 second it is in systole phase. Okay.